Dr. Klein has been helping us out over these last couple of weeks to answer people's questions about the coronavirus, COVID-19. So we ask people on Facebook or however you're watching right now to put your questions out there. They'll appear on the chat function here on this WebEx, and we will get to your questions and talk about what's going on. Lots of questions about COVID-19, both from a medical standpoint, how it's spreading around the world, the country, how we're doing here in Louisville. So that is the purpose of today's session, is to answer those questions for you. So we welcome your questions. Let me just give a little update on the virus itself. As of right now, we have about 131 positive cases in Jefferson County. That is a very large jump in a single day, about 30 cases in a single day. And so these are some of the biggest increases we've seen yesterday and today. There's a couple reasons for that. One is there's a lot more testing going on. We're getting the results of the testing right now, and there's no doubt that there's community spread of the virus as well. So this is what we've expected. This is what we have been communicating. And this is why it's so important that everybody ask themselves, how has my life changed since I've become aware of this virus, and what am I doing about it? That's why we continue to emphasize the importance of social distancing, not going out if you're sick, not shaking hands with people, the basics, washing your hands for 20 seconds frequently throughout the day so we don't transmit the virus. We're seeing the vast number of people understanding the importance of this in the community, and I want to say thank you to all of you all for understanding that this is a matter of severe illness or death in some extreme cases. We've had 3 deaths in Louisville. I'm very sad to say. Our hearts go out to their families. So I want everybody to imagine if that happened to your family because of the virus or because of reckless behavior on your part. We can look around the country right now and see what's happening when people or when the virus gets out of control. And sometimes that happens because an individual is not responsible or not doing their part. For some comparative purposes, the city of New Orleans is about the same size as we are. They have over 1,000 confirmed cases and 46 deaths as of yesterday. So if we're thinking this is something in a faraway place or just in a big city or a different country, it's not. That's why we've been doing all of these measures and all these restrictions so that we're going to limit the big spike when it visits us here in the Louisville area, so our healthcare system is not overrun, so you can stay healthy, our healthcare providers, our doctors and nurses can stay healthy again. So this is a very real thing. Unfortunately, some folks in Louisville still don't understand the gravity, the seriousness of this virus. And we continue to get pictures of people gathering in groups greater than 10 and acting as if, this is no big deal. We don't need to listen to this. It doesn't apply to me. Some of y'all will catch the virus. You may or may not get seriously ill or die, but you will pass it on to somebody that is in the most vulnerable categories, people over 60, people with chronic conditions, and those are the folks most at risk, 14% chance of death. So please, think about your personal responsibility and spread the word to your friends. New cool is saying, I get what this virus is all about. I'm going to be personally responsible for making sure me, my family members, my loved ones don't get sick. That's what's cool. What's not cool is congregating in big groups and saying, we don't have to listen to anybody. So please, let's continue to get better each and every day. John Klein is a noted physician in many areas of practice around the world and in the field of medicine. One of his areas that he specializes in is immunology, so he knows a lot about the immune system, obviously, how diseases spread. He's also a wonderful researcher as the Vice Dean of Research at U of L, so he's got a broad perspective of medicine over a storied career. He's still a young man. And we're lucky that he's here with us today to give us general observations, Dr. What's going on with the virus right now, and then we'll get into some specific questions. And we invite your questions from Facebook so that we can address them specifically. So, Dr. John Klein.
The message I want us to give today is that our efforts are beginning to work. We have some signs of it, but we need to really try harder and to be better at social distancing. Our growth rate in the state of Kentucky is somewhere around 19 to 20% every day. Um, Surrounding states and across the country are seeing growth rates of around 30%. So the measures that the governor has put into place and the mayor has put into place have had a positive effect, but we really haven't gotten very serious about social distancing compared to the rest of the country in a lot of ways. There's a really interesting new way to track how well we're doing in Jefferson County, and that's to look at the de-identified anonymous data from our cell phones and see how much less we're traveling. We're only down about 30% in our traveling over the last several days. Um, that's just not good enough. So what my message is if you want to protect your family, if you want to protect your friends and neighbors, and you want to protect your doctors and friends who are nurses, restrict the amount of traveling that you do. Leaving the house, we don't have a shelter in place order, but I think everyone should think that way, that they should stay as close to their house as they can, go out for food or for groceries or for medicines, and continue social distancing until we know that the peak has passed. Otherwise, we're going to end up with a highly stressed healthcare system with ICU beds that are overflowing, like in New York City, and real stress on the healthcare system overall. So that's sort of the general perspective. We're doing okay, but we can do a lot better, and we have to do a lot better.
Yeah, and I'd say okay is not good enough in this situation, right? So
Nope.
last week, Dr. Klein, your quote was the math is pretty straightforward. If we do no social distancing, one infected person inside of a month will infect an additional 400 people. With strict social distancing that falls to three additional people in a month. So talk about that a little bit more. And then those 400 people that are infected, they can infect another 400 people, right? So talk about how this spreads so rapidly and like what's happened in New Orleans and New York and what's kind of the math behind that and the individual behavior behind that and what that says to us here.
So viruses spread in a population based on a couple features. It's how quickly they make people very ill, and then also sort of a mathematical concept of how infective they are. How many people can one infected person infect in a single day? Well, that's a function not only of the way the virus behaves and the way it's transmitted, but also how crowded we are together. That's one of the reasons that we're seeing tremendous numbers in New York City and Seattle and other densely populated areas. Um, but also, it's because we're really social creatures. This is who we are as humans. We are at our best when we cooperate and we work together, but not necessarily in physical proximity when it's an epidemic like this. So we're kind of fighting our own nature when it comes to social distancing, and yet that's one of the mathematical factors in that graphic that you've shown several times in terms of how the virus spreads. It's not only the nature of the virus, it's not only the nature of the transmission. Is it on surfaces or is it on aerosol droplets, but also the physical proximity to people. And those numbers are pretty much just a mathematical exercise, but we're seeing them come to life in New York City, and we're seeing them come to life in other densely populated areas. We are seeing some of it here simply because we know that we are not practicing social distancing to the capability that we have.
Right. I'd like to welcome Julie Johnson on. Julie started with us yesterday. She's our signer for the hearing impaired and deaf. So thank you again, Julie. And Julie can be seen on Spectrum and Uverse, and then we'll be putting out a copy of this interview later for folks to see with her. So thank you, Julie. John, let's get to some of our questions here. Before that, maybe an observation. I want to share that yesterday a second firefighter was tested positive for the virus. So part of this we're talking about, we want people to stay healthy themselves so the hospital system is not overrun. But we also want that to take place so our healthcare professionals are not overrun and our first responders don't get sick as a result of this. So there's nobody to take care of us in these emergency situations. So I want to talk about how this virus can move through a first responder community or doctors and nurses and what we're seeing in other markets.
Well, ever since the program at the university started to test people, it's really had two major thrusts. One was to identify those people who were sick in the hospital, but the other was to protect the workforce in the healthcare system. But even beyond that, if you sort of look at that as a circle that keeps moving out, all the people who take care of us, whether it's doctors, nurses, respiratory therapists, or our police or our firefighters, they are, by the nature of their jobs, not able to social distance. So they're at greater risk than the rest of us. So one of the things that has been going on throughout all of these professions is training in the use of personal protective equipment, particularly in the healthcare arena. But when you get down to it, doctors, nurses, police, and firemen have to get close to people. So we need to be able to test them quickly to see if they're infected. We need to be able to isolate them if they are infected so that it doesn't move through the fire department or through the police department or through the healthcare system. We already have some doctors who are infected. We have some doctors who have had very strong exposures who are self-isolating. And so we see just a little bit of decrease in our capabilities in the healthcare system. But at the moment, we really have a fully functioning, intact healthcare system in the county. What we don't want to do is get into a situation where we lose so many doctors and nurses to the infection that we are not able to take care of the sickest and most vulnerable among us.
I believe Bobby Cooper with the Louisville Fire Department is on the call. Bobby, if you can share with us number of firefighters we now have on quarantine or any other remarks you have to say about our first responders, we'd appreciate that. So, Bobby, are you out there?
Yes, sir, Mr. Mayor. We currently have 2 firefighters who have tested positive. We had the initial one the other day, and then we had another one yesterday who had a positive test. Both of those firefighters are on self-isolation now at home. And then on top of those 2 firefighters, we have 8 more firefighters who, through their work and through their contact, like the Dr. Klein just explained, that had come in contact, and they've been told to self-quarantine. So a total of 10, 2 that tested positive and 8 more that were in contact with them that are either self-isolated or self-quarantined at this time. Doctor summed it up best when he said that it's the nature of our job that we come in close contact with people in order to do our job. So the best thing that the people can do, the public can do, is take deliberate and responsible actions. That's critical right now. Listen and comply with the requests of public health officials and emergency services like us. Listen to you, find the updates, and just try to comply with the requests as best as people can.
All right. Thank you, Bobby. Appreciate your all's good work.
Yes, sir. Thank you.
A couple of questions coming in from Facebook. Jonathan asked, how is the ventilator situation in Jefferson County? That's one of the data points that our incident management team is collecting every day. Currently, we have plenty of capacity. We're not seeing our hospitals being anywhere near used to capacity right now, but that's a situation where we're trying to get more ventilators as well. We're working with Governor Beshear on that. Dr. Klein, I don't know if you want to comment on that or some of the reports we see coming from New York now, where they don't have enough ventilators, so they're using one ventilator to treat two people. Can you comment on that and how the efficacy of that, or how does all that work?
Well, I'm too young to remember this, but when ventilators first became in common use, there were medical centers that tried to use them for two people and sometimes more. The very old medical literature says that it was successful. What we have now are new, more high-tech approaches to that, to sharing a ventilator. Even across the country, people are looking at this. The Speed School here at the university is developing hardware that will allow us to share ventilators. It's not ready to be used in the hospital yet, but it's basically a valve that splits the airflow between the two ventilators. So that would be a real win if we are able to use one ventilator for two people who have COVID-19.
Leanna from Facebook asks, will virus spread less as we get consistently warm weather?
That's something we had hoped. When you look at the 1918, 1919 influenza pandemic, certainly warm weather caused fewer and fewer infections, and it went away over the summer of 1918 for the most part. There's not a lot of evidence that this virus is going to go away with warm weather, unfortunately. We're not in that same situation. And in fact, in the southern hemisphere, where it's already been warm and they're about to transition into their cooler weather, we see that more and more infections are occurring. So unfortunately, it doesn't look like that's going to be the answer to this problem.
Another question, what are the efforts to reach non-English speaking citizens? If you go to louisvilleky.gov, you'll see COVID-19 in the top left. You can click on that and it will take you to multiple languages being translated with some of the information about COVID. And we're working with, through our Office of Globalization, that's led by Sabine Nassim, to get as much translated as quickly as we can. This information is, changing so rapidly that there's a lot to translate. So we're doing our best to keep up with that. If you have any specific issues around that, you could call 574-5000 or 311 and put your specific question into them, and then we'll try to get back with you on that. So 311 is probably your best bet on that. Okay. Okay, from wave 3, we've had warm weather. People are stir crazy. People are outside exercising, congregating. What, if anything, will be done to curb that or keep them from congregating? Look, we have closed down at our parks, the basketball courts. We unfortunately had to take the rims off. I didn't want to have to do that, but people weren't stopping on their own, taking the nets down, because not only are you socially close to each other, but in the case, let's say, of tennis, you're touching the tennis ball. So when you touch a surface, whether it's a basketball, a tennis ball, a soccer ball, the virus gets on that surface, and you are literally passing the virus back and forth to each other if somebody is infected. So we just say no gatherings more than 10 people. Okay, and our police department is reminding people of that, trying to break these gatherings up. I saw a picture of a large gathering last night around 13th Street, I think it was. People need to look at that and say, my job right now is to go home. Okay, Dr. Klein talked about in order to shelter in place, which just means there's no movement. Okay, we've called this, staying healthy at home, and that's the positive way to look at it, right? The opposite of that is a total lockdown on the community where you cannot get outside to spread the virus. So the more people don't comply with our directives to stay at home, the stricter the movement will become in the city. Okay, so please work with us. You can go outside, you can get your exercise, you should do that, but you have to stay socially distant from each other. Okay? And yes, this weather is beautiful, so get outside and get after that. Dr. Klein, this is from Beth, does someone only get COVID-19 once, or can it have a recurrence?
That's an unanswered question. Other coronaviruses, so cousins of this virus, can occur over and over again. We don't know if this one will have the same ability. We are working at the university on an antibody test so that we can tell if people who have had the virus have developed protective immunity. One of the really important questions to answer, and that test is just about ready for research, is whether once you have an antibody, how long does it stick around? How long do you have that protection? There's some evidence that people who have more severe infections have longer lasting immunity, while people who have very mild infections don't have immunity or protection as long.
How can we get through to our teenagers? They seem to be the ones that are congregating en masse. Well, I would say you got to talk to your teenagers about what's going on. Teenagers, for the length of time, have thought that they're kind of immune from any type of bad activity happening to them. But two, that clearly is not working as well as it should. So parents, guardians, you have to be a parent. Okay, you got to step up. I mean, it's there's just it might be hard to do, but if you don't, that virus is going to come home, and it's going to come home to you. It's going to come home to Granny. It's going to come home to great auntie, and it can possibly kill them. So I know it's hard for your teenagers. You can sit outside, but if you don't know where they are, you are not doing your job as a citizen right now to protect your family and to protect the community. And I don't like to have to speak so bluntly to everybody, but that's what's at stake here right now. So our teenagers have to help us. Tomorrow, I'm having a virtual meeting with my youth implementation team. And the purpose of that meeting is to say, folks, guys, what's not happening here? I mean, why aren't we getting our message through? My youth implementation team is a representation of the community. We're trying to keep everybody safe and healthy. They've done some incredible work for us last year. Their work on e-cigarettes and vaping to stop people from doing that, especially youth, led to a national resolution at the United States Conference of Mayors. This year, they were working on mental health issues. We're transitioning now to see how they can help the community with social distancing and helping us with this coronavirus. So our youth implementation team does a great job. So we're going to be touching base with them tomorrow to see what more we can do. But we got to create a new normal for what's like acceptable behavior and not. So that's both our youth figuring out how to do that. We need your leadership now. This is the call to your generation, and to the parents and guardians out there. You got to step up and know where your kids are and not allow them to conduct in this type of behavior. So we'll try to enforce it the best we can, but government has never been the solution for everything. Okay? And government's not your mama and not your daddy. People understand that. You need our citizens to really contribute. That's what makes a strong city. So we'll try to do that better, but we need everybody to help. Okay, Dr. Klein, there's some crazy myths flying around about the COVID-19. And to our viewers out there, remember, on a Facebook session, feel free to send in your questions. This is Dr. John Klein with us, PhD in immunology, Vice Dean for Research at the University of Louisville Medical School. Any medical questions, we're happy to take them while the doctor is in. What are some of these myths, Dr. Klein? Give me one. We'll share them throughout the hour here.
Well, I think the most unusual one I've been asked is if I gargle with chlorine water from a swimming pool, is that protective? And I guess the second one after that is, I've heard that the virus lives in your mouth for 4 days before you become ill. So does drinking a lot of water flush the virus out of your mouth? And the answer to both of those is no, that is not the case. You can't protect yourself by gargling with vinegar, with chlorinated water, or with salt water. Those are not going to protect you from the virus. Keeping your distance from infected people is really the only way we have to protect ourselves from the virus.
And in fact, I believe it was in Iran, it's the country of Iran, 3 or 4 weeks ago, somebody was selling some hoax that if you drink this bootleg liquor, it will save you. And that bootleg liquor ended up killing 170 people.
That's right. That's right. Wood alcohol is what they were drinking, methanol, and it killed over 170 people. So there are a lot of scams out there. Some of them are dressed up and look really sophisticated. You can go online and find people who are selling silver colloid based compounds that are supposed to either protect or cure this. And those have no basis in fact or science.
I will say, this virus has brought out the best in people. There's just untold acts of kindness and compassion. People giving money to the One Louisville Emergency Relief Fund. We're over $5.6 million in that now to help people. These folks that are giving money don't know who they're helping, but there's been a tremendous outpouring of kindness and compassion. But then anytime something like this happens, there's going to be some fools out there that want to take advantage of people, and that's just downright evil. Okay, so if something seems too good to be true, as we all know, it is too good to be true. Don't fall for the scam. Dr. Klein, does blood type, this is from Rachel, does blood type make a difference in either getting the virus or its severity?
Well, somebody's been keeping track of the latest science that there seems to be a correlation between your blood type and the severity of the illness that you contract. And correlation, scientists always like to say correlation does not mean causation. So the fact that one blood type may be more protected than the other doesn't mean that that's a causal relationship. But this is some of this new science. And like I said the last time we talked, the pace of science, both nationally, internationally, and at the university is like trying to swallow what's coming out of a fire hose. There is so much science being transmitted in the scientific community. And this is just one of the things this week that seems to be emerging.
Routines are important during things like this. So I'd like to ask our Facebook viewers, if you want to share like your daily routine with us on how you kind of getting through the day and what your rhythm looks like, we'll share some of those. And maybe Dr. Klein, I'll ask you a little bit later. The spread here in the community, or anybody, just to get through it. So Facebook viewers out there, what's the rhythm of your day? How have you been dealing with this? John, you talked about blood type. Another question about demographics. Is the virus impacting men, women differently, different ethnicities? What are we seeing there?
Well, one of the problems with so much scientific information coming out is that some of it is not going to be that good. Some of it will be little snapshots that don't really tell us about the whole problem. And so I'm a little hesitant, but there are data both from China and now emerging in the United States that men are more at risk than women to the severe and critical forms of COVID-19. We don't know at the end of the day, a year from now, if those numbers will still be giving us that indication. But there's some evidence of that, and scientists know that there can be sex differences in the way that an illness affects us. And so it wouldn't surprise me if there were differences between the sexes in how we respond to this virus.
Elizabeth asks, is it true that Advil feeds the virus?
This is something that's taken hold in the last 10 days. The last time we talked, I told you I got a text message from our younger daughter in Los Angeles and said, did you see this? Ibuprofen is really bad. And I thought, well, that's kind of odd. And then the next thing I knew, the entire country of France, the French health minister had said, don't take ibuprofen. And then the World Health Organization had said it. I really can't find the science that supports this. But once again, this is one of those correlations that people in public health are beginning to see. And so better safe than sorry. If you've got muscle aches or if you've got a fever, you may well be safer sticking with acetaminophen or with Tylenol.
Okay. Mary Ellen asks, are first responders being screened before and during their shifts? I can speak for city government. Yes, they are. And in our emergency operations center, where our incident management team is, every time somebody goes in, they're checked. So in the morning and then throughout the day. And then if their temperature is over, I think it's 100.4. Does that sound right, John? That, if they have a temperature, they have to go home. So we're doing that with our first responders as well. How about in the hospital?
Well, more and more businesses are doing thermal screening. So one of those no-touch thermometers as people start their shift. Some of the hospitals have begun that. And I don't know if it's uniform across all the healthcare systems. It's I think, a useful thing as long as you've got a calibrated thermal sensor or distance thermometer and you trust the results. We don't want to send people home who need to work. But we also don't want to let people in with fevers that the thermometer didn't detect. So you've got to make sure you've got the right equipment before you apply this.
And then that's one of the ways, in terms of taking vitals on the temperature, that we're able to monitor our fire department folks in particular, where we know they were good up to, let's say, noon, but then they started getting symptoms at 2 o'clock, and that's when they say, okay, let's go home. So that's how we're tracking some of that at Metro government.
And just you have to bear in mind that these thermal scanner thermometers at the beginning of your shift, they'll tell you you don't have a fever. But if somebody feels ill in the middle of the shift, they need to go home. And sometimes you can carry the virus without a fever for a day or more.
Okay. Some of our routines are coming in that people are doing. Diane's passing the time by doing adult coloring books. Rebecca is doing a lot of yoga. And Diane goes on long daily walks. So that all sounds pretty good. Let's see. Mimi asked, will medicine for high blood pressure like lisinopril aid against the virus? Am I saying that the right way?
You are, and that's a great question. This is someone who's been reading or watching. The way that the virus gets into cells is through an enzyme that is affected by those blood pressure medicines. What we don't know is whether they make the situation better or they might make the situation worse. And I'm sorry, science sometimes is ambiguous, and this is one of those things. You should not stop those medicines simply because there's a scientific controversy about whether they're helpful or harmful. You should talk to your primary care doctor when they come up for air in a period of time. For the moment, continue to take those medicines until there's a definitive answer about whether they affect the virus.
Your colleagues in Wuhan in China, when I say that, medical colleagues, now are, I guess, 3 to 4 months ahead of us, and a lot of them have gone back to work. Are we learning anything now out of China since they've gone through this that we're applying here in America?
There's a lot of information being transferred in the medical literature, and it's coming out quickly. And the Chinese scientists and physicians are publishing a lot that helps us. Some of it's very simple. That when a patient is on a ventilator, if we put them in a face down prone position, that they do better than if they're flat on their back. That doesn't mean that everyone needs to be flat on their back, but they need to be rotated. They have done the initial trials of some of the medicines that we've heard about. Some of them are published. Sometimes they're contradictory. The best example being chloroquine and hydroxychloroquine, which we've heard a lot about. And there are publications from China that say, yes, it was helpful. And there are publications that say, no, it was not. So science is never all black or white. There's always some ambiguity. But yes, we're learning a great deal from China. And the Chinese people and the Chinese medical establishment have been, by my assessment, have been fantastic in this.
We got some more people sharing what their daily routines are. Victoria is working in her garden. Sounds good. Michelle's doing activities with her 8-year-old daughter, cooking and watching movies. So Yeah, there's a lot more opportunity for close time while we're going through this. We're hearing about some adults wanting a little, or parents wanting a little relief from their kids. That's why you can go to liftuplou.com or at liftuplou on social media. The city's created this effort to bring us together online, and they've got a daily rhythm and daily routine to that you can check out. I think it's either today or tomorrow that Teddy Abrams, who's part of Lift Up Lou, of course, he's the director of the Louisville Orchestra, is going to be going around town playing music to people from a distance. So check out liftuplou.com to help with your daily routine. Min from Facebook says, I get up at 5 o'clock every morning. I pray, I meditate, I read, and I take a walk. These things help me set the tone for the day. Nice job, Min. Ruth says she sets a schedule in 2-hour blocks, exercise, chores, hobbies, listens to the mayor and governor's streams to stay informed. She meditates and she goes outdoors. So we got some meditators on here today, Dr. Klein. Let's close our session later on today with a little meditation. Can we do that again?
Absolutely.
All right. Nicole Wright from Facebook, Dr. Klein, is asking, are our hospitals seeing an increase in panicked people going to ERs with mild symptoms?
I think they are. There's a term that's taken hold in the medical community called the worried well. And these are people who are very worried about the fact that, that they might have COVID-19. In Louisville, we can just look around and see that pollen has exploded. And so a lot of people who have their usual seasonal allergies are extremely worried that their dry cough and their congested nose that we all have every year, or most of us do in the Ohio Valley, that it's COVID-19. Most emergency rooms and most healthcare systems around the country are setting up ways to screen those people before they get to the emergency room. The best thing you can do if you have those minimal sort of symptoms is stay home. And I know it's hard because there's a lot of anxiety out there. There's a tremendous amount of anxiety. But the best thing you can do is stay home if you simply have a nasal congestion and a little bit of a sneeze. That is not sufficient symptoms to justify a trip to the emergency room or to the immediate care center.
I can tell you it's been tough for me. I've been spending a lot of time doing stuff like this, and during my daily media briefings, I've got some allergies, so it's like, oh gosh, I'm feeling this cough coming on or something like this. I'm like, but I don't want to have people see me coughing thinking I'm getting the virus. So everybody is sick.
Yeah.
Okay. So just remember, cough in your elbow, in a tissue, we're people, right? But so know the difference, though, obviously, between what you normally feel this time of the year and what the virus could be. Always check with your healthcare provider if you can. So
every time I put on an N95 mask, which it's a little more difficult to breathe in those N95 masks, I'm thinking, oh my gosh, I'm short of breath. And then I calm myself down and I realize that it's just the mask. There's a lot of anxiety out there, and I have it too.
We've got Elizabeth sharing her routine with us. My family loves to play board games together, ride bike, watch movies, eat our 3 meals at the same time every day. That sounds like a good life. So good job, Elizabeth. Thank you for sharing that with us. A lot of folks coming together in the community to be part of the solution. I want to say thank you to our houses of worship, our mosque, our synagogues, our churches. It seems like a long time ago, but it was over 2 weeks ago when we gathered socially distant at Metro Hall with the press conference to hear from our imams and our rabbis and our ministers saying, this is really hurting our souls not to have our services, but there's a higher calling here that the one we worship is telling us to do right now. So I want to thank everybody for continuing to help us in their worshiping traditions. We've got a routine in from our councilwoman, Barbara Sexton Smith. She is the councilwoman for District 4. Her routine includes coffee, conversation with the love of her life. That's her husband, Lacey. Hello, Lacey, if you're watching out there with Barbara. emailing constituents, a healthy snack, cleaning, walks on Main Street, and ends the day with expressing gratitude. That's nobody can go wrong with that. We got to shower each other with kindness and compassion. I've got something here. We had a big challenge in Louisville in 1937. The Great Flood in 1937. It was one of the biggest natural disasters of all time. And so Louisville had to pick itself off of the ground and recover. And so there was a committee that came together for uplifting the spirits of the city. And here is the mantra that they had. And I printed it out so that I can be reminded of it each and every day. And what they said here was the mantra of the city: I will not complain. I will not spread bad news. I will be encouraging, helpful, and friendly. I will work unselfishly. I will give all I can. I will do my part toward building a better and greater Louisville, and I dare you to catch me not smiling. All right, so as we think about how we can help each other through this thing, acts of kindness and compassion, and the simple act of a smile. So, Councilwoman, I want to thank you for what you're doing, and you've always got a big smile, so nice job. Facebook viewers, we're just asking people to share what their daily routines for us. It's important to have a rhythm to help you get through times like this. So feel free to share your rhythms on Facebook, and we'll read some of them out there.
Mayor?
Yes, sir.
I brought a visual aid too. I wanted to share something that I saw just this morning, and I don't know if this will project, but this is the entrance into the research building at the university I work at and have worked at for a long time. This is the Donald Baxter Research Building. And what you can see, there are Post-it notes beginning to be put up there. And that's the first one.
Yeah.
And it says that we're praying for the custodial people who have to clean this building. And this one says, praying for the medical researchers.
Yeah.
And I just wanted to tell you that these Post-it notes have started to appear all over the health science campus. They're over where our COVID-19 coordination center is. They mean a lot. It means a lot. These people are working 20 hours a day, sometimes more than that, on the COVID-19 testing. So these little acts of compassion really add up. They make a big difference to the people who are in the trenches. So I want to say thank you to whoever put those notes up. Keep doing it.
Right. And start doing it. We're social creatures. We got to connect at the heart, and we're all born that way. That's really the whole kind of thought process behind our compassionate city movement, that we're all born with compassion and kindness and love in our hearts. And sometimes as we get older, we forget that. So compassion is making sure that we recognize that, we come together through our spirits first, and then we can have disagreements, but we appreciate each other as human beings, and we want to see our human potential flourish. And it's being put to test right now. There is no question about that. And it is hard. And anybody's going through this is not thinking this is difficult. It is difficult, but we got to call on our well of strength, our common bond of compassion, and we'll get through it. We know we're going to get through it. So let's all be able to look back at how we performed, did this, and say, you know what, I was part of the solution. I'm proud of my behavior, and I'm proud of how we did it together in our compassionate city. So thanks for sharing that, John. That took somebody 5 seconds to do that, but the impact of it, I mean, it gets me a little teary when I see stuff like that, just to say, this is a very personal type of thing. Jean is asking, I have allergies. Is Benadryl okay to take?
Well, I can't give specific medical advice. So what I'll say instead is that as far as I have seen in the medical literature, there is nothing bad about Benadryl during this time of the COVID-19 pandemic.
Okay. Thank you, Joan, I believe there.
And on bad days, I'm still taking my antihistamine as well.
Okay. Taylor asked, is the virus airborne?
Excellent question. The answer is probably not, unless it's in an aerosol droplet, which is to say when we sneeze, there's a little liquid that comes out every time we sneeze or cough. But just the naked virus in the air, there have been some reports that it exists there, but there are others that it isn't. I think the greatest risk, most people would agree, is in droplet form. So coughing, sneezing, it can linger on a surface for a while, and we need to be aware of that.
Has we gotten any better science on that in terms of how long it will stay on a surface and different surfaces?
I think I told you earlier in the week that scientists are interesting people. And so there's somebody out there who has been culturing a virus like the coronavirus or like the COVID-19 virus that we know of on different surfaces and then measuring its survival, which is really useful, but still kind of out there. And it appears that for about 24 hours, the virus can survive on paper or cardboard. Metal, it seems to survive longer, at least in the papers that I've read, particularly steel and copper. What that says is that it emphasizes the need that we have for consistent cleaning in our homes with a good antiseptic or antiviral solution on high traffic areas that we're going to touch a lot, like light switches and bathroom fixtures and countertops.
Okay. Related to that, somewhat related to it, Whitney asked, can the virus be carried through vaping?
I don't know the answer to that. I do know that vaping is not good for you. It's bad for your lungs. It seems to make your lungs more vulnerable to injury. So, just by inference, we're going to say that smokers and vapors are going to get a more severe case if they contract the case. And that's just sort of an extrapolation, but it's not a real stretch.
So if you ever thought about quitting smoking or vaping, now might be a time where that could save your life.
I think it's a great motivation. I know how hard this is. I've taken care of patients for years who are smokers, and I know how hard it is for most people to quit. But if you ever had a good motive, your own survival immediately, your immediate survival, this is the time. And we've got time to think about it too.
I want to thank our viewers here on Facebook. We're with Dr. John Klein. He's the Vice Dean of Research at the University of Louisville Medical School and a PhD in immunology, and has been our featured guest on The Doctor Is In now for the last couple of weeks. So please send your medical questions in to Dr. Klein. I'm Greg Fisher, the mayor of Louisville. You can find lots of information about the COVID locally by going to louisvilleky.gov, and you'll see at the top left of the homepage, COVID-19, click on that. It'll take you to all of the different resources we have. And then you can also contribute to the COVID relief fund. We've raised over $5.6 million now, and that money is going out to individuals that have been hit financially because of COVID-19, helping them with things like food and rent and childcare so that they can get through this until the federal relief package comes. And I want to make sure everybody's paying close attention. Yesterday, the third supplemental is what they call it for federal relief, was signed into law, and that will be directing direct cash assistance to everybody that's filed a tax return. Will be receiving $1,200 if you make $75,000 or less, and $500 per child in your household. So if you are married, that's $1,200 times two, $2,400. If you have two kids, that's an additional $1,000 on top of that. That money is meant to get us all through this financially. And then there's some supplemental unemployment benefits available for 4 months also through this federal program. So I'm hoping that news is relieving a lot of stress, financial stress on people to say, okay, we're going to be able to get through these next 4 months. And then we'll see what the new normal is, if that needs to be extended. But pay attention to that federal relief package yesterday. Small businesses also, massive amount of assistance in there for small businesses. They are the heart and soul of our community, and that small business relief will help people get through this crisis as well. So, so much news coming along, but this understanding the federal relief package is really important to know how this is going to positively impact you. So be sure to check that out, and you can go to louisvilleky.gov Facebook.com/Louisville Forward. And we're answering some of the questions about these relief packages. So check that out. Lori is asking, is there any study on alkaline versus acidic environments with this virus? Would alkaline keep us more immune?
There's no studies that I'm aware of. I've seen emails circulating that if you eat bicarbonate of soda and you become more alkaline in your blood, that is protective. That's just incorrect. If you eat bicarbonate of soda, it really doesn't make your blood more alkaline if your kidney functions normal. Your kidneys just get rid of the bicarbonate and maintain that exquisite balance that they're known to do. So I think the alkaline diets and drinking alkaline fluids, if you want to do that, then that's certainly people can do that, but it doesn't seem to have any known effect on the virus itself.
Jessica's asking, how well stocked are the local hospitals with personal protective equipment, and do they need more donations? We absolutely will take all donations of PPE. We can never have enough. We have received some of our portion from the national stockpile for the community, and we're spreading that through the hospitals, but that's not enough either. Okay, but we're in a pretty good position right now compared to other cities. We are finding different PPE and these N95 masks that you hear about as well. We are supposed to have 250,000 more of them being delivered early in the week. That has been our biggest need. But yes, we're at about 50-60% of where we want to be. That being said, we have several weeks worth of supply. Dr. Klein, do you want to comment on that?
No, there's a lot of anxiety in the hospitals and among the doctors and nurses about the supply. They seem to be holding up, but we see what's happening to our friends and our colleagues in New York City, and it worries us. On the bright side, there are a lot of people working on this in Louisville and in the surrounding communities to produce either masks or, again, the Speed School has stepped up and is making prototypes of plastic face shields that can be worn over a surgical mask, and that together is better protection than just the surgical mask. They've already been in talks with a company that can make many thousands of those face shields with an injection molding process. So once again, I guess I have to put a plug in here sooner or later, but this is why cities and really great cities have research universities. And in particular, ours is U of L, because researchers can quickly mobilize to develop new approaches. There's a lot of different expertise in one place. So that's my one plug for the day.
And that's what we call a fact. Okay, so between the medical school, the Speed School of Engineering at U of L, there's amazing innovation coming out. I think there's 120 or so of these research institutions in the country. So it's super important that U of L is healthy and active in this area. Can we get that question back to the team there? Can we get Connie Mendel on the line from our public health department to talk about what she's seeing as she goes about and visits some of these different companies? We have a 311 line we've set in place for people to report when there's large gatherings or there's suspected unsafe, not inappropriate lack of distancing taking place in the workplace. So, Connie, are you on with us? If you come on, Connie, just interrupt where I'm saying, because we've had a question here about GE. GE Appliances has mentioned that they're going to start back to work on Sunday night. And there's lots of employee questions about that. Is it safe to go back? What's taken place at GE? GE management and the union of GE, Dino and Ashley with the IUE, and then Kevin and Dr. Hahn, all have said, look, we want to make sure when we're going back to work, because GE is deemed an essential business because of what they make, that our working conditions are safe. So our public health department was asked to come out yesterday and observe the protocols and the work protections that were in place with GE. People are impressed by all the changes that have been taking place in the plant to make sure it is safe. And then we provided some additional suggestions through our public health department. So we welcome those type of invitations to make sure that the workplaces are as safe as they can be. So that's the role of the government, is to, in this case, is send a public health resource, make sure the workplace situations are safe and healthy. And then obviously it's up between management and the workforce as to how they're going to execute their business from there on out. I want to ask one other, or want to make one other reminder here for people joining these conversations later. Look, there was a large gathering of people on 13th Street last night. I think it was 13th and Broadway. It looked like hundreds of people reveling in the fact that we're together and we're not going to listen to the establishment. Our lives are going to go on here, and we're not going to be told how to live. Let me just say that, young people, rebellion is a normal kind of instinct, and thinking that you're immune from any kind of damage. The virus doesn't care about that. Okay, science doesn't care about that. The virus is coming for all of us, and it's just looking for an opening. When there's large crowds, that's how the virus spreads. Look at what happened in New Orleans at Mardi Gras. We have 3 deaths in our city right now, which are all tragic. New Orleans is over 50 right now, and that number is going to escalate very rapidly. And you're seeing the same thing happen in New York. That's what will happen when large crowds gather, like what we saw last night on 13th and Broadway. So please reflect and say, okay, I made a mistake, but I'm not going to make it again. So we will be dispatching our police department as best we can to this, but we can't cover everybody, and government is not the answer to everybody. We need parents to step up, know where their kids are, keep them where you can see them. And I know that's hard too, and almost impossible sometimes. But if you love your child, if you love your family, if you love your parents and grandparents, that's what you got to do to keep everybody safe. So please, everybody, do not gather in more than 10 people. And if you do, keep at least 6 feet apart. Okay?
Mr. Mayor, this is Connie Mendel.
Oh, good. Okay. Connie is one of our great professionals with the Metro's Department of Public Health and Wellness, and she does a lot of our field visits and company interface. So, Connie, you want to comment on what you're seeing with businesses and how'd it go at GE yesterday?
Sure. Our staff are going out to a lot of businesses. We're contacting them by phone and doing in-person visits. And we are even speaking to people that are congregating on some street corners. Most people are receptive when we see people out and about, when we ask them to separate and social distance and try to maintain that 6-foot barrier. We're doing a lot to educate a lot of businesses, just trying to help them start to implement these practices. I did visit GE Appliance Park yesterday. I got in 5,000 steps during my visit. So I did tour the various buildings, production lines. Since they've been shut down, they have implemented a lot of measures. All walking areas have taped off areas measuring 6 feet as a reminder, and to just give you that visual cue to stay 6 feet apart. They have they're going to slow down the production lines when they open back up to about half pace. They have eliminated about half of the positions along the production line, and they've installed large plexiglass barriers. They've marked off spaces. So anywhere they're trying to implement 6 to 8 feet between employees. And again, like I said, they've got plexiglass between different areas and other physical barriers between employees. And they've got cleaning buckets assigned to all the areas. So with sanitizers and gloves and disposable wipes, they've spread out chairs at break rooms in various areas. They're going to stagger breaks and other things so people are not congregating at the same time. And they're going to discontinue the job rotations or swapping. So you're not going to have people, taking places at the job so we don't have those touch points contaminated. So they are, doing a lot of those practices. I met with production management and union representation there. They all have my contact information. We can we can revisit if we see any additional problems or questions. We're here to help them out. to operate as safely as possible.
Thank you, Connie. Our public health and wellness department is just working 24/7. And Connie, you and everybody there are doing a wonderful job. So thanks for helping out around our community. And we want people to be confident when they go back to work. So thank you for applying those best practices there. Okay, one last question then, John. Maybe we can, I think it was our last session where you led us through a little meditation, telling us about the health benefits of that. So I'll take this question from wave 3. It's like, we've told people that the federal relief package won't solve our city's budget problems. That's true. We're hoping for another package to come along that will help that, so we can make sure we keep all of our public employees, our police officers, our firefighters, public health department, et cetera, employed and in good shape to deliver services. So knowing that being said, what do you recommend for people who live paycheck to paycheck, who will be getting these relief checks of up to $1,200 and $500 per child? How can they make the most of their money? Well, the first thing I would encourage everybody to do is, if you get direct deposit right now on your paycheck, that's how the money's going to come into you. If you don't, you're going to get it in some other form. They're determining what that's going to be right now. But if it comes to you in a check where you've got to cash it somewhere, think now about setting up a bank account so that you don't have to have a large fee when your check is cashed. We're working on that. Certainly don't use a payday lender or somebody like that that's going to take a big chunk out of your check, or get a loan in advance where they're going to eat up a big chunk of your check as well. And then think about the money that you got coming in. Know what your unemployment benefits are, both state and federal, if you've been working. And then that's what your budget should be for the next 4 months, because you got 4 months of unemployment supplemental coming from the federal government. And then I would, do a daily or weekly budget so that okay, here's what I got, here's how much more I go. And then we're just going to have to wait and see how all this comes along in terms of going back to work. But be on the lookout for going back to work. There are people hiring right now. Kroger, Walmart, Amazon, they're all hiring. So there are opportunities out there. But most of all, take care of yourself. Be safe. This whole relief packages that are out there are meant to ensure that you can stay home and then still, financially survive through this, because we're fighting both a health crisis and a financial crisis. So those would just be a few comments on that. So it's always good to take a little time for ourselves and make sure that we're in a good place so that we can be effective throughout the day. And one way to do that is through just kind of taking deep breaths from time to time. Other people call it meditation. Dr. John Klein, let's close out our session here. What do you call it?
Well, what I'm going to do today is called a compassion meditation. And, compassion, we can tell, the neuroscientists tell us, what parts of the brain are responsible for when we think compassionate thoughts and when we choose to do compassionate things. So there's real science behind this. We know at the medical school and teach medical students this form of meditation because we know that it helps equip them to fend off or to deal with the stress of just being a doctor. Well, now we're all pretty stressed. And so I think that it's a pretty good thing. Burnout is common in a lot of professions, and burnout in our society over the last month is probably something we're looking at. So what we're going to do is a very brief compassion meditation, and think of it like going into the gym. Compassion is like, building your compassion is just like building a muscle. You just got to practice it. And this is one way that you can practice it every day. So let's all put our feet flat on the ground and uncross our legs. You can
do a 2-minute timer.
Yeah, I'm gone. Go.
Okay, here we go.
Okay. Close your eyes or just simply lower your gaze. And the first thing I want you to do is I want you to think about yourself. And I want you to say these things. May I be safe. May I be happy. May I be healthy. May I live with ease. And I want you to say that to yourself a few more times. And then I want you to think about someone you really love. And, it doesn't have to be a person even. It can be your pet. Someone who, when you think about them, it makes you smile. want you to think of them and say, may you be safe, may you be happy, may you be healthy, may you live with ease. And then I want you to think about those people who are out there still working, sometimes at great risk to themselves, that you don't really know. So the person who checks you out when you go to the grocery store, or your doctor, or the policeman that you pass by, or the fireman. I want you to visualize them, and I want you to say to each of them, may you be safe, may you be happy, may you be healthy, may you live your life with ease. And I want you to sort of get a bird's eye view of the whole city, like you were looking down from a drone. Think to yourself about the whole city. May you be safe, may you be happy, may you be healthy, live your life with ease.
There we go.
There you go.
Dr. John Klein, Doctor of Life, Doctor of Meditation. Thank you for taking us with. Just taking a couple minutes to do some deep breathing is always a good idea. So it helps us all get centered, helps us get more productive, and helps us open our hearts up, which is at the end of the day is what it's all about. So everybody, you can get some more of your daily rhythm in by going to liftuplou.com or at liftuplou. There's mindful parenting we had on the other day and some other music and cooking and meditation. So please check it out, and just know that you can reach 311 at metro.311 at louisvilleky.gov if you have anything to report, if our 311 lines are overwhelmed. And you can view these streams on Metro TV channel 184 on Spectrum. I want to thank Julie Johnson for being our interpreter here today. And everybody, stay safe, stay focused, focus on those you love, and show that by being socially distant, and remind everybody about the importance of that. Thanks for joining us here on our Teletown Hall with the doctors and Dr. John Klein. John, thank you so much for being with us today.
You're welcome. Really happy to be here.
All right. Greg Fisher, Mayor of Louisville, out. Everybody take care.